Well, let's go to the wonderful Peta Credlin, a refreshing individual in all of this, but very gifted indeed. Peter, there are 60,000 critical cases in the world of 7.7 billion people, 29 in Australia, 770 deaths in the world, but in Australia. But then we've got a document that says, well, only 9% of them, only 9% were recorded coronavirus exclusively. I mean, none of this we're told, and we're in the mess we're in. You tell me. You're in government, you've been in government. What is the answer here?
Well, I think two things I want to say, listening to all of the commentary at the top of the show. One thing's really interesting. We're seeing a contestability about health advice.
Correct.
From a lot of experts here and overseas, credentialled epidemiologists and virus experts, against the health bureaucracy in Australia who aren't specialists in all of those conditions, in a way that we never see with the climate change debate. So health science is contestable, but climate science is not. So that's very interesting. That's very interesting. And today in Victoria, Brett Sutton, who's the Chief Medical Officer here, admitted that the curfews in Victoria were not put up by him. They were not endorsed by him. Indeed, he wasn't at many of the meetings. It wasn't done under the state of emergency powers where he has a role. They were done under the state of disaster powers. So they were a political decision of the Premier. Now, that's the first time we've ever heard about that. Up until now, we thought the curfews were all part of the health package, that everything he says, Daniel Andrews, is he's got no choice, he's got to follow the health advice. Well, the curfews are not the health advice. So the worry for Victorians is there's no light at the end of the tunnel. We had the failure of the hotel quarantine system to contain the virus, and then once it was out there, the failure of the contact tracing system to manage the virus. Greg Hunt confirmed that he sent Alan Finkel down, the chief scientist, down to Victoria at the start of the year in March. Well, Sutton hasn't read the report from Finkel, never bothered to meet Finkel.
No.
We know that Hunt said he offered them all the back-end IT that they needed back in March. Well, right now, the Premier announces today he's sending a whole lot of people up to Sydney to sort of sort out why you're so good at it and they're so crap. Well, hello, you know, we're September, we're a long way into this. But more than that, Sutton today admitted, I cannot believe this, but they're operating under fax machines and bits of paper. That is the contact tracing system. So I've lost complete confidence in this, Mob.
Well, let me just ask you this.
I supported the lockdowns when we were up to 700.
No, well,
you know, I said, we've got to do it hard and sharp. This is, you know, we're in a lot of trouble. No, they've lost me.
Yeah, well, they've lost me too. But I don't understand. They can't read. Now, you talked about the contestability of health advice. Now, Professor Woolhouse, I've mentioned many times, is a member of the Scientific Pandemic Influenza Group that advises the British government. And he said 2 weeks ago, lockdown was a panic measure. And I believe history will say that trying to control COVID-19 through lockdown was a monumental mistake on a global scale. Now, Peter, what justification is there for having, and every state has got some form of lockdown, why can't we say the vulnerable we'll look after, the rest of you, 99%, it's going to be mild. Let's look after the vulnerable, the elderly, the sick, those with comorbidities, the Indigenous, the people in regional Australia, and then say, right, get on with your life, let business open and get on with it.
Yes, well, your Professor Woolhouse, I hope he said that at the start of the pandemic because, you know, we've both worked in government and there are a lot of people that are wise after the event from the cheap seats. I think where we are now, there needs to be a serious, you know, forget this rubbish that's called National Cabinet, there needs to be a serious revision of Australia's COVID plans.
Definitely.
Where are we at? What are we doing? Revise it. Pull all the medical advice again and rethink it because, you know, we and the world have changed in a lot of this thinking and epidemiology in the last 6 months. And also, and this is a really important point, everything going to Daniel Andrews is focused on the health COVID impacts, not cancer, not mental health, not job losses, not bankruptcies, not foreclosures, not mortgages going on. All of the other stuff related to the impacts of this crisis have to be put into the decision making. Right now, it is just the COVID deaths, and no leader can only make a decision with one sliver of the information put to them. They need the whole breadth.
Just before you go, I want to ask you one other thing to add to all of that. What about the children? There are kids now who haven't been to school for 3.5 months. The psychological, the emotional, the mental thing, cooped up in Melbourne, like, as I keep saying, battery hens. The whole educational environment being completely damaged.
Year 12.
Does anyone care?
There was a mum today who called in on 3AW, and she said her Year 12 daughter, who was the dux of the school in Year 11, so bright kid, can't get out of bed. She's so utterly depressed. She's got all the pain of the Year 12 year, none of the monumental milestones that stay with us for the rest of their lives. And the mother is, bringing in counsellors and doesn't know what to do. She's at the end of, her tether.
Absolutely. All right, Peter. It's great to talk to you. I'm getting letters like that. Sometimes they're so close that you don't discuss them in forums such as this, but it is undeniable.
It's so sad.
The mental and psychological damage being to young people, and I can't believe the heartlessness of premiers and ministers of the Crown. It's
but how are you
belief.
going to get change, Alan? Just before we go, how on earth can we get some change? Because the Parliament's not even sitting here in Victoria. It's fixed term. There's no election for 2 years.
No. Good on you. Good on you, Peter.